Imagine two patients, both diagnosed with cancer in the exact same organ. You might expect their journeys to look identical, but as one structure collapses inward while the other slowly stretches out, their actual treatment plans and outcomes can be entirely different. Public perception often frames cancer as an external invader, similar to a virus or a bacterial infection attacking the body from the outside. Biologically, cancer is a broad group of related diseases. It occurs when our own internal cells break their normal operating instructions, growing and dividing without the usual checks and balances. This rogue behavior can begin in nearly any tissue or organ, from the skin and the lungs to the blood and the bone. The specific location where this growth first develops is known as the primary site. Because we are dealing with a breakdown of our internal systems, understanding the disease requires zooming in to the microscopic rulebook that governs our bodies. This flowchart tracks the strict, orderly life cycle of a healthy cell. Normal cells grow when the body needs them, divide in a controlled sequence, and eventually reach a programmed cell death when they become old or badly damaged. The instructions for this cycle are written in a cell's DNA. Over time, factors like aging, UV radiation, or inherited variants can introduce copying errors. While most mistakes are harmless, a specific combination of errors allows the cell to bypass the signals to stop growing. Not every cancer grows at the same speed. Some cell clusters take years to develop, which contributes to the wide variance in treatment plans between patients. The disease is an information problem. Corrupted genetic instructions convince the body's own building blocks to ignore their normal life cycle. When these rogue cells form an abnormal mass, we call it a tumor. A malignant tumor is aggressive. It expands, invades, and damages the healthy tissue around it. A benign tumor is not cancerous and generally stays in one place. While it won't spread to distant organs, it can still cause serious health issues if it grows large enough to block an organ or press against vital structures. However, not all cancers form these masses. Blood cancers, like leukemia, usually bypass solid tumor formation entirely, with abnormal cells instead circulating through the blood or bone marrow. The danger of any cancer is determined by its capacity to disrupt or destroy the specific local environment it inhabits. If a malignant tumor is left unchecked, it can undergo metastasis. This is the process where cancer cells break away and enter the bloodstream or lymph system. These traveling rogue cells can then exit the vessels to establish new, secondary tumors in distant parts of the body. When this happens, the disease maintains a specific naming convention. Metastatic cancer keeps the name of its original tissue regardless of where it travels. Breast cancer cells in the lung are still treated as breast cancer. Biologically, they continue to behave like the tissue of their primary site, which dictates which medications will be effective. Metastasis marks a critical threshold, transforming a localized issue into a systemic crisis. To build a treatment plan, doctors evaluate the disease through two primary metrics, stage and grade. On the left is stage, mapping how large the primary tumor is and how far it has spread. The right side represents grade. This measures cellular chaos, how abnormal the cells look, suggesting how aggressively they behave. By combining these metrics with biomarker testing, which identifies the specific proteins or genetic changes driving the growth, doctors can use targeted therapies and immunotherapy to train the patient's own defenses to recognize and attack the cancer. A low-stage cancer can still be high-grade, requiring a much more intensive response than a larger, low-grade mass. Each treatment plan is built specifically around the intersection of these variables for the individual patient. A cancer diagnosis is not a personal failure. It is the result of complex genetic changes, some inherited, some environmental, and some occurring through random chance, accumulating over time. While some cancers are cured, many others can be managed for years in remission, where signs and symptoms have significantly decreased or disappeared. Viewing cancer as a trackable breakdown in biological rules provides the data necessary for intervention. By understanding the specific mechanics of the cellular failure, patients and medical teams can navigate a path toward personalized treatment.